joining me here today. My apologies for the little delay in our start. I want to recognize that we're on Treaty 6 territory, as well as acknowledging the Métis people of Alberta who share a very deep connection with this land. More videos have surfaced in the last few days reinforcing that Danielle Smith wants Albertans to pay for their health care. She wants you to pay out of pocket to see your family doctor. This isn't smear, this isn't spin, this is a simple statement of fact. And to prove it, I'll turn things over to Danielle Smith to explain in her own words.
If we made a different approach? What if instead of paying for that 100% with the government paying it directly, what if they deposited the money in your health spending account and you paid your doctor out of your health spending account when you visited? They'd give you a nice little debit card. It would have your name and face on one side like a driver's license, and then you'd swipe it and $37 would come out of your account. Government has already made a determination that certain services are ones that you should pay for yourself. And to me, it's entirely arbitrary. So if it's arbitrary, why don't we create a system where people have the means to pay for the healthcare that they need based on their own choices, and then we allow them to make those choices and see what happens. Instead of it being public versus private, it's what gets paid for 100% by government through your catastrophic insurance coverage that is publicly funded and publicly administered, and what services get paid for through your health spending account. And that is partially funded by government, partially funded by your employer, and partially funded by you. If your employer pays for your services on your behalf, why does the practitioner you're dealing with have they don't have the same incentive to give you the very best possible service as if you're paying yourself, right? And so there's a reason why you want to restore the patient-doctor relationship and the payment relationship. What if?
So this was a long video. We've clipped together the pieces where Danielle Smith talks about her actual healthcare plan to make it very clear for all of you to see. Danielle Smith explains her plan is to dismantle Alberta's healthcare, and I find it incredibly disturbing. She, in her own words, says that she wants to create a payment relationship between patients and their doctors. She wants Albertans to swipe a credit card to get treatment. She wants to create a system where Albertans have to pay for the healthcare that they need. And she wants people to fund their own healthcare choices. This is Danielle Smith's plan, and it's clear as day. We know because she wrote it as a very detailed plan that she published with the University of Calgary in June of 2021. And then she toured around the province describing this plan to folks on camera, just as we saw here in one of the interviews. The media has given Danielle Smith several chances to disavow her policy paper, but she's refused to. These videos represent the real Danielle Smith. This is why Albertans can't trust her with their health care. Alberta is still in the grips of a healthcare crisis. When Danielle Smith tries to deny this fact, you can hear the truth from healthcare workers that face it daily on the front lines. Like the doctors who said this week that the lack of an OB/GYN in Lethbridge is a full-blown women's healthcare crisis. Or the disaster that the UCP has made of the diagnostic lab system, which means that you can't book an appointment for lab work until after the next election. There is so much more, and it's time for change. And this is why I'm proud to be a part of Rachel Notley's team. An Alberta NDP government will work to connect 1 million Albertans with a family doctor and a family health team. And you're never going to have to pay to see that doctor. We will cut emergency room wait times and reduce surgery delays, and we build hospitals where they're desperately needed, like the one in South Edmonton and another in Red Deer. And we will support frontline healthcare workers who have carried so much on their backs over the past several years. Danielle Smith, meanwhile, has spent more time sympathizing with those awaiting trial for criminal charges than she has working to make life better for frontline healthcare workers and patients. And her plans for the healthcare system show that this isn't by mistake. Danielle Smith doesn't support public healthcare, and Albertans can't trust her with their healthcare needs. Thank you, and I'm happy to take your questions.
Thank you. Just a reminder, if you're on Zoom, it's the raise hand function. If you're on the phone, it's *9. We'll start in the room. Okay, we'll go to the phone. Catherine, your line is open.
Thanks very much, and good afternoon. So as you mentioned, this was from June 3rd, 2021, when Danielle Smith was still a private citizen. And, you know, to sort of react to some of the criticism that your party has been given. She says that we're committing to Albertans that under no circumstances will any Albertan ever have to pay out of pocket to see a family doctor or to get medical treatment they need. Do you think there's a difference between someone speaking in a role as a private citizen versus, kind of reality of governing hits as a premier, or what do you think about the difference?
So this is absolutely the authentic Danielle Smith. This is after she was cut loose from Chorus Radio for having extreme views, and before she had folks trying to keep her in line because they were afraid they were going to lose power and lose the government. She's auditioning to be the most trusted person in Alberta. She wants to be the premier of this province, and that means she will have responsibility and the right to make decisions on behalf of more than 4 million of us. Clearly, her values do not align with Albertans' values when it comes to their health care. If they get cancer, they don't want to have to swipe a card to be able to get a diagnosis, to be able to go get treatment, to even go see your family on it and a barcode. And she describes it. It's essentially a credit card that you would have to use to pay for your health care. Albertans don't deserve that. They deserve a premier that they can trust, who is reliable, and who's not going to cause more chaos and cost for them and their family.
Do you have a follow-up, Catherine?
We already have a system where we have health spending accounts or employer-paid insurance, and kind of a combination of government-funded and, private insurance. Where do you stand in terms of a health spending account for things that aren't already publicly insured?
Some employers will set up a variety of different types of health benefits for their employees, and employees can negotiate that if they're part of a union. Some negotiate to add more to the health spending account. Some negotiate to have, a day to take care of a loved one if they get sick. This is a process for things that are outside of the public health care system. A visit to a family doctor, or really any doctor in the province of Alberta, should never be outside of the public health care system. That should always be a guarantee for anyone. You shouldn't have to show any card to be able to get the health care that you need when you're when you're ill, or when you're in time of crisis, or when you simply need to go for an annual checkup. You shouldn't have to think, like, is this really, should I spend my $37 on this, or should I spend it on something else? And Danielle Smith is incredibly disrespectful to ordinary families when she says that that's not onerous. $37 might be the difference between buying groceries this week or not. So to say that people should have to, go around and act like consumers and choose what to buy and not buy, they shouldn't. They should be thinking about their families, they should be thinking about their health, and accessing a doctor when they need it without fear of there being any barriers or cost.
Thank you. We'll go to our next caller. Morgan, your line is open.
Hi there, thanks for taking my questions. Ms. Hoffman, I'm just looking for a bit more context on the video, if you're able to provide it. Where is the video from? And I'm just looking for the earlier conversation of the clip that leads up to the Premier's responses.
Thank you very much. It's an hour and a half video. It's on YouTube, and we'll send you the link. And at this moment, I can't actually remember the outlet that she was meeting with, but she did travel around it. There have been, so she published this paper when she was when she was let go from Chorus, and she was spending this time, or left Chorus. I'm not particular on the circumstances there. But when she left Chorus, she started writing policy papers and doing this media circuit. So in June, she did several interviews talking specifically about wanting to make people pay to see a family doctor, and this is part of that hour and a half long interview, and we're really happy to give you the YouTube link and the context from there.
Do you have a follow-up, Morgan?
Yeah, I do. And beyond increasing family docs and decreasing emergency wait room times, I'm wondering if you could talk about what specific investments the NDP would make to modernize or update the healthcare system. I see in this video we have kind of the Premier's ponderings on that from a few years ago, but I'm wondering what you think would be good to modernize or update.
Yeah, thanks for the question. And just 4 years ago, I was the health minister, and I'll say one of the things that we worked to was to make sure that people have electronic health records that they can access themselves from home, or or for themselves or for a loved one. And that's something that definitely was long overdue. It was a significant investment, but it meant that we've all been able to get our lab results and other important information in a much more timely way than it was when prior iterations of Conservative governments were in power in the province of Alberta. But the biggest thing for us is we're in a crisis time right now. When I was health minister, we in any of the major centres in Alberta, you could get a family doctor within a day. That is not the case anymore here in Alberta. We have Lethbridge, where half of the folks in Lethbridge don't have access to a family doctor. In the Bow Valley, there isn't a single family doctor who's taking on new patients. And I've talked to many folks in Edmonton and Calgary who are really struggling to get one as well. So one of our biggest policy pieces is that we're going to connect 1 million Albertans with a health home, with a family doctor and a family care team to surround those services. So that's probably the biggest step, and it shouldn't be something that has to be revolutionary or seen as super modern, but under Danielle Smith and the UCP, we've seen them move backwards, and we actually want to get back to having that foundational relationship with a family health doctor and with other allied health supports to support them in providing care for their patients.
Thanks, Morgan. Just to let you know, the video is from YouTube, an interview with Enterprise Group, and we can send you the link. We'll go now to our next caller, and that's Rob. Your line is open.
Hi. Danielle Smith's opinion from before she became premier, like her policy paper and her columns, they've all been public before. They've all been stories about it before. She now says that the health spending accounts she promises would not apply to visits to your family doctor. Why is what you're releasing now, this video, why is, it's from 2021, why is this important?
Thanks. Yeah, it's just a couple of years ago, and this is when she wasn't responsible to be reined in. This is Danielle Smith speaking freely, speaking truly about what her values are and what her opinions are about the healthcare system. I know that, we saw Jason Kenney sign a big piece of cardboard, and we saw Danielle Smith put a piece of cardboard with the same words on a podium in front of her. But if you think back on when they talk about public health guarantee, just shortly after the election, almost immediately after the election, the UCP had a plan to chase family nurses, registered nurses, out of the system. And they were moving very aggressively on that. We had a health minister who showed up and yelled at a doctor in his driveway, who got phone numbers for doctors to have intimidating conversations with them over the phone. We know what their values are, and Danielle Smith says that she thinks it's important that patients be consumers, that we be customers, rather than focusing on a patient-doctor relationship as something that doesn't need to be paid for. She says that it would be better if you paid for it. Well, it would be better if we actually had family doctors. She talks about people going around and shopping for a new doctor. You can't even get one in many parts of this province right now. So these are her values, and she is in the process of applying for the most important job in our province, to be the premier of our province, to be making decisions based on her values for the next 4 years. And I'm here to say that as we continue to learn more about Danielle Smith and what her true opinions are and what her true beliefs are, we can't trust her with public health care.
Do you have a follow-up, Rob?
No, I'm good. Thank you.
Thank you. We'll do one more pass for questions. Just a reminder, if you're on Zoom, it's raise hand. If you're on the phone, it's *9. Seeing none, that concludes today's press conference. Thank you very much.
Thank you.
Much for watching, and to learn more, check out albertasfuture.ca.